second, yeah, we on that time. 60 on the board, now we start that climb. Get ready, get set, yeah, the moment's now. When it hits zero, we gon' show you how. Run! Yeah, 50 seconds, feel the energy rise. Heartbeat fast, yeah, you feel that vibe. Lights get bright, yeah, the stage gets set. We ain't even started, but you ain't ready yet. 40 on the clock, now we pick up pace. Every second count, yeah, we in that race. Crowd tuned in, yeah, they locked in tight. Whole room buzzing, yeah, we taking flight. Yeah, 30 seconds left, now we turn it up. No slowing down, gotta fill that cup. Energy peaking, yeah, it's building fast. Blink one time, might miss that blast. 30 on the clock, yeah, we feel to the heat. Baseline knocking, got you out your seat. Hands go up, yeah, we ready to go. Whole vibe shift when we hit that flow. 10, 9, feel that energy climb. 8, 7, yeah, it's almost time. 6, 5, yeah, we live right now. 4, 3, let me hear that crowd. Steve on the mic, yeah, the nurse got skill. Break it down smooth, keep the whole squad chill. Talking about kidneys, yeah, we keep them on track. If your numbers off balance, he gon' bring them right back. Got the wisdom on deck, no stress, just facts. Hydration, motivation, every time he reacts. From the clinic hallway to your podcast feed, dropping gems so fresh, yeah, that's all you need. Steve the kidney nurse, yeah, you know the name. Keep your body in check, yeah, we play no games. Real talk, real health, yeah, we keep it pure. Tap in right now, Steve the kidney nurse, yeah. Steve the kidney nurse, yeah. The kidney nurse.
YouTube, Facebook, what's going on? What's going on? It's your boy Steve, the kidney nurse. Welcome, wherever you're watching from. Let me adjust my scully. What's going on, YouTube and Facebook? This is a special edition. Oh, I got the wrong background up. That's not the background I want. This is the background I want. Hold on. I'll be right back. All right, fam, we're back. We're back. And tonight, we're talking MRSA. All right? And what you should know, especially if you're on dialysis. There we go. MRSA, what you should know. Now, before we get started, as always, I always put up the disclaimer that the information that's provided on Dialysis in Life is for educational and informational purposes only, and is not intended or implied to be a substitute for professional medical advice, diagnosis, and treatment. And in fact, this is not Dialysis in Life. This is At Night with Steve, the kidney nurse, but the same still applies. So welcome. If you're watching from TikTok, you're watching on YouTube, Facebook, welcome, good evening. Give me a shout out where you're watching from. I see we got my friend Jeffrey Phillips, who was a guest last night. watching all the way from Trinidad. We have Najla Fareed. Good evening. Thank you for watching, Naja. Appreciate you. But the topic tonight, MRSA. How many people heard of it? How many people been affected by MRSA? There's many people who has been impacted by this condition, but they're not going to really sit there and shout it to the mountaintop. But if you want to share in the comments if you've dealt with this situation, condition, MRSA, please share your experience. Now, MRSA sounds like a big word, but it's not, chat. It's not. MRSA is pronounced Mrsa. Mrsa. You may have heard it as that, Mrsa. MER-SAH. Mrsa. Well, you may hear him say MRSA. Right? Now, MRSA stands for methicillin resistant Staphylococcus aureus. Anybody like, great day. That sounds like a big word. It's not. It's not at all. And in fact, we're going to break it down. We're going to break it down, chat. Now, the S, Staphylococcus aureus, often referred to as staph, is a type of bacteria that is often present on the skin or the inside of the nose, your nose flares of healthy individuals. If, however, these bacteria get under the skin, an infection can occur. Bloodstream infections, septicemia, urinary tract infections, and pneumonia can also be caused by staph. And see, a lot of patients that just started dialysis, maybe been on a year, I can say 2 years, maybe 3, and newer, and you ask them about, you heard of Mrsa? What? Have I heard of what? Mrsa? Yeah. No, I haven't. And see, this is something, when you're doing your research, it falls under infection control. Now, the M in MRSA, we already said the S stands for Staphylococcus aureus, which is often referred to as staph, is a type of bacteria that is often present on skin or inside the nose flares right here of healthy individuals. And I repeat, if, however, these bacteria get under the skin, they get under the skin, an infection can occur. Now, bloodstream infections, septicemia, urinary tract infections, and pneumonia can be caused by staph. Anybody watching has been impacted by staph? Please share your experience. We're not here to judge. We're here to listen. Now, the M in Mrsa stands for, guess. Did anybody on TikTok that's watching, or YouTube or Facebook, does anybody know what the M stands for in Mrsa? And if you don't, it stands for methicillin. Methicillin. Methicillin is a type of penicillin. That illin, that N, that's all part of that penicillin family. Amoxicillin, methicillin. It's a type of penicillin. It was developed in 1959, but it was later replaced by other penicillin forms. R in MRSA stands for resistant. The word resistant means that bacteria will no longer be killed by an antibiotic. So you see how we broke down MRSA? So thus for MRSA is therefore a Staphylococcus aureus organism that has become resistant to all penicillins. Methicillin resistant Staphylococcus aureus. And so Mrsa is a Staphylococcus aureus organism that has become resistant to all penicillin. So if you get Mrsa, they can't treat it with no penicillin because it's resistant. So now we had to give you another class of antibiotics. Now, let me say, I got 2 questions in the comments. That's what I like. People come and interact. Oh, we got Latashia Gardner in. What's up, beloved? Good to see you. Hope everything's going well in B-more. I'm still holding it down up here in DC. You know what I'm saying? But thank you for your support and stopping by. Yep. Thank you for your support. I appreciate it. Hey, Leticia, we talking about Mrsa, MRSA, which I just finished breaking the acronym down. Methicillin resistant Staphylococcus aureus, which Leticia is a Staphylococcus aureus organism that has become resistant to all penicillin. So if you get Mrsa, they can't treat you with amoxicillin or any type of penicillin because that type of bacteria is resistant to it. But the big question is, who gets MRSA? That's the big question. That's the big question, chat. Who gets Mrsa? You know, some people are like, Steve, that's happened to me before. Oh, yeah. Latasha, absolutely, it's a big topic. But again, the question is, Latasha, who gets it? Staph infections occur more often. Check this out, Latasha. I hope I'm pronouncing your name right. If I'm not, please correct me. But staph infections occur more often in people with weakened immune systems. And if you got kidney failure, transplant, especially transplant, because with the anti-rejection drugs, your white count is pretty much down. And so you got to be careful. Yeah, and that's what I'm about to get into. Najla. I hope I pronounced your name right. I'm just going to call you Naj. I don't want to mess that up, beloved. But you're right. You are right. And some more to that. But who gets MRSA? MRSA? Staph infections occur more often in people with weakened immune systems. Persons with chronic illnesses, such as diabetes and kidney failure, are therefore at greater risk. Now, I know a lot of people don't trust the CDC. I damn near don't have faith in the CDC. But according to CDC, MRSA infections are seen more commonly in healthcare facilities, such as hospitals, nursing homes, and dialysis centers. Hey, chat, have you ever been to the hospital and then they want to admit you, right? And then they want to stick a Q-tip swab right here in your nose that we got to check you for MRSA. And they check you, and some people are positive for it, and some are not. But they see MRSA is seen more commonly in hospitals, nursing homes, and dialysis centers. Now, when a MRSA infection originates, if you get MRSA infection outside of a healthcare facility, chat, if you get MRSA outside, or if it originate outside of a healthcare facility, it is known as community acquired MRSA infection. Now, with this type of form of infection, just as I thought so. I thought so when I first saw your name. because of me sending the book to you. Hey, MD Nas, what's going on, beloved? Peace and blessings to you. Welcome, welcome. Glad you can stop by tonight. Thank you so much. So, Mrsa is pretty much on the skin. Latasha, Mrsa, Mrsa mainly affects the skin. Now, when that infection gets into the bloodstream, right? I gotta fix my crown. You know how y'all women fix your hat? Y'all call it a hat. But no, when that infection gets into the bloodstream, then that is septicemia, sepsis. We get into the bloodstream, just on the skin surface now. But here we go. Check this out. As I mentioned, when a MRSA infection originates outside of the healthcare facility, it's known as community acquired MRSA infection. And with this form of MRSA, skin infections, this is where you're going to see your pimples and boils are usually seen. You remember, I remember back when I was a young kid, teenager, I got a boil in my groin area. Y'all know, and but like the fold of your leg down in that pubic region where a lot of moist can develop bacteria. That's a breeding ground. And you remember, you got that boil on the side of your leg, and they tell you, go sit in the hot tub and let it come to a head. Or put a hot rag, in boiling water and put it on there, and you see it come to a head and the, pus come out. Or, worse come to worse, you may have to go and get it lanced. You just never know. Now, here's another question we're going to ask ourselves. What did you say, Latisha? Wow, question doesn't everything start inside first in the skin? Yeah, so that's why they swab you at the hospital in some places. If they admit you, they might swab you to see if you got MRSA. Now, say MRSA develop on the skin, but if it gets in the blood, that's when you can become septic. Sepsis is a bloodstream infection. But the second big question we want to ask, can MRSA, TikTok, what's up? Can MRSA be prevented? Can MRSA be prevented, chat? What you think? It can. It can. I wouldn't say everything. Because look, if you get a scratch, again, on the top of your skin, or come in contact, which I want to show you what to avoid, that's on the outside. But yeah, a lot of things do develop on the inside. But when we're talking about Mrsa, that's skin to skin, as mentioned that, I think, MD Nod. But this can be prevented. Now check this out, LaTashia. Staph aureus infections are more likely to spread from person to person if close skin to skin contact is present. So you can be with your loved one. And remember that Ozzy Brothers song, In Between the Sheets? You remember? In between the sheets. But no. Close skin to skin contact is present. Hygiene is poor. Living conditions are crowded, or skin is not intact, as seen with cuts and abrasions, or at the catheter site. You can get Mrsa, your access. You got a catheter. So this is why this type of information is very important for people who are on dialysis. Because this can happen out of nowhere. Seriously. Let's say you go to the hospital for a procedure and come to find out you got Mrsa. You don't know how you got it. Now, again, let's look to see what the CDC recommends to help you and me to avoid a Mrsa infection. Now, let's see what Latish got to say. Hey, over on TikTok, you can come over on YouTube, put your comments in. I'm a little bit far back from the screen. I got to look up to see. Empress is a long time. Oh, MD Nas, you was on that Big Gil. What's going on? Empress, Keith Hughes, Bowley, Kiera, what's going on, beloved? Hey, what's up? Good to see you. Hey, I want a beef patty. I want Jamaican beef patty. Good night, Empress. So, what does the CDC recommend to help avoid a Mrsa infection? Let's see, this right here, chat, wherever you watch it from, those of you that are here, you are meant to be here to hear this information, because let me tell you something. I swear, a lot of patients on dialysis don't get a chance to hear the nurse or sit down with the nurse to get information like this explained to them to help them avoid becoming a victim of circumstances. So let me give you 7 tips to help avoid a Mrsa infection. The biggest one, I always tell you, chat, the biggest one, keep your hands clean by washing thoroughly with soap and water or using a hand-based sanitizer. That is simple and plain as you can be. But we often miss these simple little helpful tips that can be a lifesaver. Again, number 1, keep your hands clean by washing thoroughly with soap and water or using an alcohol-based hand sanitizer. Okay. 2, keep cuts and scrapes clean and covered with a bandage until healed. I repeat, keep cuts and scrapes clean and covered with a bandage until healed. Excuse me. Number 3, avoid contact with other person's wounds or bandages. Now, if you're in a position, hear me out, TikTok. Happy Sunday, Michelle. Welcome. Welcome. We on YouTube, Facebook, TikTok, so you can come on over anywhere and participate. But welcome, beloved. Welcome. Frugal Living, welcome. I see you. Thank you for showing up. We're talking Mrsa. And right now, I'm at tips to help avoid a Mrsa infection, Frugal Living. And I don't think, and you know, and I know Frugal Living, I used to be up in the boxes and stuff. And you won't see nobody on TikTok trying to educate on MRSA, Mrsa, to help you so you go to the clinic to keep you protected. So if you're in a position where you have to change a wound, yours or someone else's, a loved one, make sure you're wearing gloves. You're washing your hands thoroughly with soap and water or an alcohol-based hand sanitizer. Number 4, avoid sharing personal items such as towels or razors. I want to repeat that again. Avoid sharing personal items such as towels or razors. Number 5. Now, this could be controversial, okay? But I'm just reading the information. Avoid dialyzing with a hemodialysis catheter. And a lot of you like, Negro, please. I ain't taking this catheter out. But they say use only when essential. Now, that's not the case for many people. That's not the case for many people. Number 6, if a hemodialysis catheter, MD Naj, if a hemodialysis catheter is in place, wear a mask during put on and takeoff. And when they changing the bandage or the dressing for the catheter, make sure you got that mask covered over your nose, because again, the healthy people, the Mrsa, so you got a technician, changing your dressing with no mask on, or a nurse, and breathing down, and you got that opening that's going under the skin. Breathing down, the germs could get on this, man-made. And bacteria loves this type of stuff. Also, the 7th tip, which is one of importance. When holding your access site, you got a graft or fistula, when holding your access sites post-treatment, wear a glove. I can't stress that enough. Wear a glove and remove it before leaving your chair. And then go to the sink where I showed you. You see one, MD Naj. Don't y'all got one near the scale? Anybody watching and you go to dialysis, is the sink near the scale? My nurse comes 3 times per week. Okay, how much fluid is safe to remove? Hey, I wouldn't remove more than 3. That's why we recommend gaining between 1 to 3 liters between treatment. Because anytime you start getting over 3 liters, hey, for a lot of people, they cramp and not even pull out 3 liters. But you got to remember, let me tell you something. When it comes to fluid, right? Removing fluid. 3 liters, if you multiply that times 2.2, that gives you how many pounds of fluid you're pulling off. So 3 liters times 2.2, that's 6.6 pounds of fluid. Now, as you can see, the more you go up, that's how many pounds. I see people taking off 5 liters. That is crazy work, because you're putting strain on the heart. And so this is why, hold on, let me finish this, and then I'm going to jump into that. Stick around, Michelle D. I just got one more sentence. So, can MRSA infections be treated? Yes, they can. Antibiotics other than penicillins. Remember I said Mrsa, methicillin resistant. Methicillin is a type of penicillin that is resistant to all forms of penicillin. So antibiotics other than penicillins can be used to treat Mrsa. Treating these infections, however, is sometimes difficult. It may require special antibiotics, plus successful treatment may take longer. The measures that I presented to avoid Mrsa infection is, of course, the best approach. Now, let's shift our gears. All right. Let's shift our gears to, hold on. Let me see what we got over here in the education vault. What we got in the education vault, Michelle? Uh-oh, what do we got? We got, why is fluid important? The nurse takes 4+ from me. We only do twice a week in Jamaica. I had to pay for. Yeah, I have a couple of people I know in Jamaica. You're right, it's twice a week. And they take 4 liters. So even in Kenya, Michelle D. Oh, MD Naj back and forth. All right, I got something for you. Hold on. So this is live. It's not Memorex, so you're liable to get anything on here. Hold on. This for MD Naj. Hold on. Since I seen you on YouTube and TikTok, this song for you. This for you, MD Naj. You know who this is? Hey, Lily. Come and jam with some Cameo. Back and forth. Back. This for you, MD Naj. Yeah. Want to see? Yeah. Back and forth. Back and forth. Yeah. Yeah. I thought about that when I saw you over here and I seen you on TikTok. I appreciate the love. I appreciate the love, beloved. But Michelle over in Jamaica, I didn't forget about you. And what I was about to say is my host from Kidney Hub, East Africa, brother Moses Kennedy, also known as the Kidney Ambassador, from Kenya, goes twice a week. And it's a struggle. But let me give you some tip busters, Sister Michelle, if you haven't heard of this, and anyone else who's struggling with managing their fluid between treatments, especially if you subjected, like my dear friend Michelle D in Jamaica, to twice a week. Michelle D, please share my YouTube page. We just had no, he's from Trinidad, but please share my YouTube page and my TikTok page to the brothers and sisters on dialysis in Trinidad. You can't soak up this great information by yourself. Pass it on. So check it out. Hey, Joe Foster, what's up? We got Joe Foster on here. Joe, I'm on YouTube and TikTok and Facebook. So I turned my camera so you wouldn't see me from the side, get a profile. You know, like I'm in a mug shot. Turn to the left. Turn to the right. Face front. But no, Michelle, I'm going to give you some tips for fluid control, and hopefully it can help. And if you don't get it all down, hit my DM. Don't be no stranger. Now is the time. It's not the time to be proud. That's for anybody. If I say something and I didn't go back over whatever, hit my DM and I'm more than welcome to take a picture and send it to you. Hello. And I would do that. But here go some tips called thirst busters for fluid control. 1, suck on frozen grapes, if you haven't heard of that. Strawberries, blueberries, and lemon wedges. 2, chew gum. If you got some chewing gum over there, bubble yum, but chew gum to help produce saliva. Sports gum, such as quench gum, help to relieve dry mouth and quench thirst. You know them soccer players. I know y'all be playing soccer over in Jamaica. You know, they have sports gum that they be chewing out on the field, right? Sugarless. They got Lisa Baxter's in here from the Lisa Baxter Show. Also, you can use a spray bottle filled with lemon-flavored water to spritz your mouth. Now, I want to be a little silly. I can say you can get you can get a spray bottle, put some ginger beer in it, and just spray. You know what I'm saying? Get some ginger beer, put it in the freezer. Shit. Put it in the freezer, get it out, put it in a little water bottle. As soon as you get thirsty, you know. Oh, okay. Okay. Oh, okay. You got a sweet taste. Right. Also, limit hey, thank you, dialysis. I appreciate that. The kittens and the roses. Welcome. I'm Steve the Kenny. I'm just acting silly. You know, they say I'm just shooting the ball, kicking the bobo. But no, one thing you gotta look at too, Michelle. I know being over in Jamaica, I know that food is good. All right. Hey, I went to a place today, but she called Caribbean Kitchen. No, Caribbean Garden. She didn't have the food ready. I didn't go back, man. I ain't coming back. But they be selling some good stuff. Beef patties, chicken patties. I know you like goat, jerk chicken, stewed chicken, curry chicken, the escovitch fish. A lot of that has high in sodium. And you know what happens? If you took chat, how many of you took chemistry and you heard of the element board? I mean, the element table. Anytime where sodium, salt goes, you're going to be thirsty. It's a fact because of the molecule, the hydrogen and the sodium molecule bonds. Well, no, it's not the food, but it's the sodium. This is what I'm getting to. The sodium for the fluid. And so some people may feel thirsty. I know it gets hot in Jamaica. Yeah, I know it gets hot and some people get thirsty. So these are tips to help keep you from going over the 32 ounce per day. See, the recommendation is, now I don't know over in Jamaica since it's twice a week, but here in the US, they recommend 1 to 3 liter gain between treatment. So they recommend 32 ounces per day. 32 ounces. This right here is 20 ounces. So 10 more ounces. And then you got to take into account your medication. So that's why you kind of want to break it down. If it's 32 ounces, you could break it down to however you want. What I mean by breaking it down, you want to do 4 8-ounce glasses over that day. Oh my God. Hold on. I got to get this call right quick. Oh my God. Hold on. Shit. Hold on. Hey, what's going on?
Is it too late? Are you sleeping?
Yeah, I'm sorry about that. That was, as you say, my baby mama. Wait, that was my daughter, my baby mama. That was my daughter's mom from Texas. So I had to get that to make sure everything was okay. Especially when you got a 16-year-old. And I'd be like, what? I got a 40-year-old daughter, 40. She got 2 kids, a 16-year-old granddaughter, my 13-year-old grandson, and then I got a 16-year-old daughter. That's a little fun fact about Steve, the kidney nurse. So that was my 16-year-old daughter's mother. Everything is okay. Knock on wood. So let's get back to this tips buster. So Michelle, I hope you're still here. So limit salty and spicy foods as they will increase thirst, chat. Limit salty and spicy foods as they will increase thirst. They don't call me that. I told them don't call me that. They call me Dad. Cause hey, that made me feel old. MD Nod. You know what I'm saying? But I appreciate you, beloved. Pop. Shit, that's why I be in the gym working out. You know what I'm saying? But yeah, it's all good. Here's another tip, Thirst Busters tip. Enjoy a piece of hard candy like mints, lemon drops, or sour candy. Now, if your clinic is next to a Family Dollar, oh, okay. Yeah. One of my TikTok friends said she's going through menopause and it makes it worse. So that's understandable. But as I was saying, if your clinic is next to a Family Dollar, Dollar Tree, that would be one of the things I would suggest getting out of there instead of the canned foods, like the hard candy. You get a big bag of mints, sour candy. In fact, excuse me, we used to have a patient that go over there and come back and have like a bag, a big, almost like a garbage bag of candy in there. Hershey Kisses, Hershey's, the small one, Butterfingers, all the small ones, Reese Cups, the Smarties. Y'all remember the Smarties, the sour candy, those sweet tarts? And he had a lot of stuff in there, man. Sour Patch Kids. And staff used to get out there. He go around to each patient chair, and they get, man, this shit was crazy, man. But hey, like at 4 or 5 o'clock in the evening, he have it, that sugar rush. Especially if you've been there since 5 in the morning. You opened up and it's 6, 4 in the evening, and you've been putting on back to back. Also, rinse with a refreshing mouthwash and practice good oral hygiene. That can be help with fluid control. Also, here's one. Satisfy thirst by enjoying a frozen treat. Now, I know in Jamaica, they got frozen treats, Michelle. Hey, Ash, my friend. What's up, beloved? And I don't mean that in a disrespectful way. I don't want you to be report me. Trying to report me, you know what I'm saying? I be like this, right? Hey, Dwayne, IEH. Y'all see me? I be leaving out my basement like this. I be like, Ash, why you do that? You know, I had to, Steve. What's going on, Ash? Oh, yeah. Yeah, and you know what? That's my laugh. I just wanted to make you laugh. I hope everything's going well. You're back home in your surroundings. And so I wanted to make you laugh. I hope I put a smile on your face. Seriously. Yeah, I know. And that's the last one on my list right here. That's the last thing on my list, Michelle. Good blood sugar control can help reduce thirst. Good blood sugar control can help reduce thirst. And so, to sum this all up, controlling fluid intake will help prevent fluid-related hospitalizations. I kid you not. I can't tell you, chat, how many people, patients, call the unit. They get the phone. Hey, can I speak to the charge nurse? This is Steve. How may I help you? Steve, this is so-and-so. I'm in the hospital. What's going on? They said I got fluid on my lungs. What? Yeah, they said I got fluid on my lungs, so they're going to dialyze me back to back for a couple of days and discharge me. Okay. And so sometimes the unit don't pull off enough fluid and it can be trapped or hidden in your lungs. Yeah, and I'm sorry. I'm sorry for that. I really am. That you're going through it. But just keep pushing forward, beloved. And if there's anything I can do, I'm not rich or anything. But if there's anything I could do to help, lighten the load or whatever, please, you know where to find me. And I'm not just saying that, me saying it, sometimes you don't want to overstep your boundaries, especially on social media. Boy, I tell you, shit get mixed up in a minute. Next thing you know, it's a conversation about you in somebody else's box. That's on the messy side of TikTok. If you haven't seen it, it's a messy side of TikTok. I'm staying on the clean side. But yeah, Michelle, let me and for many people may have just came in, I want to go over why fluid is important, and then I want to end the broadcast because I got get ready for my trip tomorrow to Austin, Texas, where I'm going for HD training, home hemo. So if you live in Austin, please hit me up. Maybe we can just have a meetup in the hotel lobby or something. The Amigos hotel lobby. But no, if you're in the Austin area, please send a shout out and maybe, we can meet. But I'll be there for training till Friday. So what time is it? Okay. So why is fluid important? Many of you may have already heard this from your clinic, from the tech, from the nurse, from the dietitian, from your doctor, from the nurse practitioner. Yeah, I probably heard it a lot about fluid. But let me try to give you, oh, thank you. Let me try to put this in perspective so we can kind of give everyone an understanding on why they harp so much on fluid. By managing fluid and sodium intake, these symptoms can be prevented. Now, if you're watching this and you go to dialysis and they're taking off a lot of fluid, say 3 liters or more fluid, right? You may have experienced some of these symptoms that I'm about to say. High blood pressure between treatments, low blood pressure during treatment, cramping during treatment. Marge, what's up? One of my old co-workers, well, I ain't gonna say old, one of my cohorts that we used to work together, Marge just entered the chat. What's going on, Marge? So cramping during treatment can be prevented. Shortness of breath, swelling, and most importantly, damage to the heart. Now I'll ask, if you're watching this and you take off more than 3 liters sometime, what are some of the symptoms that you have experienced during treatment due to fluid overload? What are some of the symptoms you have experienced? Put it in the chat. Again, we're not here to judge. We're here to listen and to find solutions. Now, let me tell you something you should know about fluid. Most people feel best when drinking 32 ounces of fluid or less per day. Yeah, Michelle, I see you. I repeat, most people feel best when drinking 32 ounces of fluid or less per day. Remember this: 16 ounces, 2 cups of fluid equal a half a kilo or 1 pound. I repeat, 16 ounces, that's 2 cups of fluid equals a half a kilo or 1 pound. Now, aim to gain no more. I repeat, aim to gain no more than 1 kilo per day. That's 2.2 pounds. I repeat, aim to gain no more than 1 kilogram per day, which is 2.2 pounds. Also, what you want to know about fluid: know what count as fluid. I'm not on dialysis, Junior. I'm a kidney nurse. However, I do have stage 2 kidney disease. Welcome to the live. Now, know what counts as fluid, because some people may not know what counts as fluid. You know what I mean, MD Naj? Some people may not know what counts as fluid. Any drink, I repeat, any drink or food that is liquid at room temperature, such as gelatin and homemade soup, is counted as fluid. How long does it take for a kidney to fail, though, if you have hypertension, if you happen to know? Yeah, watermelon has fluid. Hey, I can't answer that question, Junior, because everybody's different. But what I can tell you is diabetes and hypertension are the 2 leading causes of kidney disease, kidney failure. What I can tell you is you can go right now, make an appointment, and get your blood work taken at your doctor to see what your GFR is. That stands for glomerular filtration rate, to see how well your kidney function is. You can see what your numbers at to see what stage kidney you may be in, kidney disease. If you're dealing with hypertension, and since you wrote that, sound like you concerned. Now, Junior, I don't know you from a can of paint. You just happen to be lucky if you want to go through with this. I wrote this book, Conquering the Big 3, a guide to diabetes, hypertension, and kidney disease. Now, I'll send you a free copy if you send me your address in the DM. That's if you want it. If not, because you're like, I don't want to get my address to you. I don't know you. You got this skull cap on, hoodie. Who you? That's fine. It is available on Amazon and Barnes and Noble. Or you can go to my website, which would still be the same of give me your address, because I send the books out. So it's on you, but I just thought I'd offer it to you since you raised that question. But definitely go get checked out and keep your blood pressure in range. All right. Oh, Amazon. But if you're already on dialysis, I would recommend this book right here. This is the first one. How to Survive Outpatient Hemodialysis, a guide for patients with kidney failure. And then this is the newest one right here. I don't have my second book, but this is the newest one, the last one, Navigating the Dialysis Journey. This is a guide for families to help them understand what their loved one is going through and dealing with kidney disease. Very great book. But know what counts as fluid. Any drink, watermelon included, any drink or food that is liquid at room temperature, such as gelatin and homemade soup, 1 cup of ice melts to about 4 ounces of fluid. 1 cup of ice melts to about 4 ounces of fluid. Also remember this, chat, especially if you got diabetes. Sugar, caffeine, and salt may increase your thirst. Sugar, caffeine, and salt may increase your thirst. So here's some tips to track fluid intake if you don't already know about this. Measure fluids using a liquid measuring cup. Find out, oh, absolutely, absolutely. Amazon, or you can go to my website, Steve the Kidney Nurse. I send it to Jamaica. If you want, I'll sign it for you. Measure fluids using a liquid measuring cup. Find out how many ounces are in each cup, mug, or glass used at home. Keep track of fluid intake by writing it down. Read beverage labels to find out how many ounces are in each container. Remember that all fluid counts. This includes fluid you drink during dialysis, fluid used to take medications. You got to count that in. And also you can do 4-ounce bottles of water, and you can have 8 of them. That equals to 32 ounces. Tips to manage thirst. Rinse your mouth frequently. Brush your teeth to keep your mouth minty fresh. Use a mist bottle to spray your mouth. Chew gum. Suck on hard candies or lemon or lime wedges. Try eating frozen fruit instead of ice or water. Use lip balm to prevent dry lips. Use lip balm to prevent dry lips. If you have diabetes, manage your blood sugar. I cannot stress that enough. If you have diabetes, manage your blood sugars. Now, we're coming right down to the end. What to know about sodium. Know that sodium is a mineral that can cause increased thirst, fluid retention, and high blood pressure. Let me repeat that, chat. Sodium is a mineral that can cause increased thirst, fluid retention, and high blood pressure. That's why we always harping about fluid intake. Right? And you see some patients come in, fluid overload. Especially if you don't urinate, you want to be careful with that. The recommended amount of sodium daily is 2,000 milligrams. That's the recommended daily allowance, 2,000 milligrams. And some people eat out and they eat more than that. Especially eating oodles and noodles, Chinese food, carry out. 1 teaspoon of salt is 2,300 milligrams. That's more than the daily recommended, 1 teaspoon of salt. Fresh food is best. Hey, Joseph. What's up, Crystal Holly? Limit salt when cooking. Try flavoring food with salt-free seasoning blends or herbs, Crystal. Find low sodium recipes. You can go to allrecipes.com. High sodium foods to limit. Sodium is hidden in many foods, even if it is not added during cooking. Tip: check the milligrams of sodium on the nutrition facts label. Another high sodium food to limit: processed foods, including canned foods and processed meat, like going to Subway. All that shit high in sodium. The turkey, the salami, the chicken, all that at Subway is high in sodium. Also, you want to be careful of, processed meats such as bacon and sausage. A lot of people like to go to McDonald's for a bacon and sausage biscuit. Burger King. Tip: choose fresh or frozen food instead of canned. And I would stay away from frozen if you can. But it seems like frozen seems to have less sodium than canned food. Also, limit packaged foods such as chips, pretzels, and salted nuts. Choose low sodium, salt-free, or unsalted versions when available. So with that being said, that brings a close to the broadcast. I'd like to thank everyone for tuning in. As I say, I'm preparing to travel tomorrow, so that's why I'm ending the broadcast early. I started, still got to go out and charge my car up as well. But thank you, everyone, for watching. YouTube, Facebook, we see you soon. God bless. Have a great week if you go to dialysis. I'm going to probably continue the conversation on TikTok just for a couple of more minutes and get ready to get out of here and finish packing and get my stuff together for this flight tomorrow. So with that being said, again, thank you everyone for coming by. And we're going to sign out with your boy's theme song, Steve the Kidney Nurse. Here we go.
Steve on the mic, yeah, the nurse.
Take care, everyone. God bless. And we see you during the week. Peace and blessings.
Steve on the mic, yeah, the nurse got skill. Break it down smooth. Keep the whole squad chill. Talking about kidneys, yeah, we keep them on track. If your numbers off balance, he gon' bring them right back. Got the wisdom on deck, no stress, just facts. Hydration, motivation, every time he reacts. From the clinic hallway to your podcast feed. Dropping gems so fresh, yeah, that's all you need. Steve the Kidney Nurse, yeah, you know the name. Keep your body in check, yeah, we play no games. Real talk, real health, yeah, we keep it pure. Tap in right now, Steve the Kidney Nurse, yeah. The Kidney Nurse, yeah. penny nursing.